I'd like to tell you about a new mobile pain treatment program for neuropathy, peripheral neuropathy, that is now available in Florida. So we have a mobile pain treatment program. This is the RELATYV Mobile Pain Treatment Program. We are offering a treatment called neurofunctional pain management, and it can be performed offsite. It can be performed in your home. Specifically, the program we're talking about here today is peripheral neuropathy treatment, and I wanted to go over some of the details of that. Most of you watching this are very familiar with neuropathy. You probably found this because you have neuropathy pain, and you may be looking for treatment options and things like that. So obviously, burning, numbness, tingling, and pain, all those things associated with neuropathy. And one of the things that I've noticed over the years with most patients is that specifically with neuropathy, it's very difficult to get around. The mobility becomes a major problem. Walking is painful. It's difficult. I've talked to hundreds and hundreds of patients with neuropathy issues. And whenever there's multiple pain conditions that a patient has, typically the neuropathy is often the one that's the most limiting for them, most difficult to engage in regular life activity. So it tends to be the one that most people want as a mobile program. Additionally, there's just very few treatment options for neuropathy. If you already have the condition, then you know already that going to a pain management doctor, primary care physician, or internal med, any of those physicians, their medications, that's what they're going to do. They're going to say, here you go, try this med, see if it helps. I have talked to hundreds of patients and seen hundreds of patients who have been on medications that either just no longer work. They wear off after a while. You start to build up tolerances for the medications, then they increase doses, and then potentially they will up to a totally different medication, and after a while, there's not much they can do. I have met patients who have been on medications for 20 years with neuropathy, and they're basically taking the meds at this point out of habit, and they're saying that practically nothing helps the actual neuropathy pain. So there's not a lot of options out there. And when it comes to interventional procedures and surgeries, there's also very few as well. Nowadays, with the opiate crisis going on, and all the doctors out there being more and more restricted and more regulated on the use of opiate medications, and which is obviously, everyone will agree that opiates, are risky and dangerous, and curbing back the prescription on that is needed. But in a lot of, especially with chronic pain issues like this, the underlying pain condition is still there. So despite the medication you're taking, despite the, whatever it is, or even in the case of opiates, the underlying condition is still there. And that's why there needs to be an actual treatment program for this. So that being said, most doctors are just going to, throw medications your way and say, try this and see if it helps. And it will likely only work for a while. So if there's going to be an actual treatment option, the other issue is getting to the office for it. So neurofunctional pain management, let's talk about that. So most of you never heard of it. It is a program that I developed back in 2018, and it uses three components of actual therapy. So we're using electroanalgesic therapy, we're using IV nutritional hydration therapy, and health coaching. And I'll explain why all of these are very valuable. So number one, electroanalgesic therapy. Most of you have never heard of this. Most doctors have not heard of it. Now, there's a few, I'd say there's a lot of doctors who do know what it is, and actually probably some that do use it in their office. It's a device, it's an electrical therapy, and a lot of people would say, oh, that looks like it's just a TENS unit. And if you don't know what a TENS unit is, it's like the muscle stimulators that you see in different physical offices, like a PT or a chiropractor office might have a TENS unit that they use in the office for that to stimulate muscles. You can actually buy TENS units on Amazon. So that's probably why you don't see a whole lot of doctors offering TENS units in their office, because TENS units are, if you talk to doctors, and I've talked to hundreds of doctors as well, a lot of them say, yeah, TENS unit is practically only about as useful as while it's running, and after you turn it off, whatever the issue is probably will come back very quickly. Some people have good outcomes with that, but keep in mind what we're talking about is completely different. And I'm talking about a TENS unit because that's what people are familiar with when they see electrical devices. Electroanalgesic therapy is very, very different. It's at a different classification of electrical device. So TENS units are on a pulse range of about 1 to 450 pulses per second. And electroanalgesic ranges are in the thousands, and our device goes up to 10,000. And that's important because what the equivalent is, and this is how the medical and the scientific system will classify it. TENS units are muscle stimulators. Electroanalgesic systems are neural stimulators. Very, very different. Now, that high pulse technology will actually stimulate neurons, pain neurons, and will create what's called depolarization. And during the actual treatment, there's a term called sustained depolarization. So you electrically, induce the neuron to depolarize, and it can no longer send pain signals to the brain. All right. So there's a lot of value in that. What will happen is the pain signals stop, and you reduce that pain and inflammation cycle. So all the pain doctors out there know this. There's this pain inflammation cycle. You have a pain issue, and the body will trigger inflammation, which will trigger more pain, which will trigger more inflammation, right? So this cycle, and in breaking that cycle or de-escalating that cycle is one of the primary objectives in pain management. And a lot of these medications are trying to accomplish that. They're trying to accomplish some sort of interference with that pain inflammation cycle. So electroanalgesic therapy actually produces this outcome. So it produces basically an inflammation reduction model where it inhibits the pain cycle and reduces that cycle of pain and inflammation. While it's doing this, it also is releasing, when you depolarize the neurons, you're releasing a lot of neurotransmitters and neuropeptides. And those do have a very positive outcome on you and on the pain and on everything. You'll end up with, a lot of people describe just feeling really good. I would say euphoria. It's not quite like that. I mean, it's more like I just feel really good. A lot of people describe it as kind of like a runner's high. I've got my treatment today, feel great, and the neurotransmitters being released are endorphins and enkephalins and GABA. And yeah, those are the ones that you would typically experience with something like a runner's high, that good physical workout feeling you get after, and so a lot of people do say, I feel great, I'm out of pain, and I have energy and I feel good, right? And I'm like, that's great, because this treatment is producing a lot of those outcomes with patients. And again, I'll tell you some of the stats on how many patients actually experience these kinds of relief. But okay, so electroanalgesic therapy, an amazing technology. And by the way, it has been in the market officially as an FDA cleared treatment for pain and vascular stimulation. It's been in the market for 35, almost 40 years now. So it's not something brand new. And that's something that's to our favor, it's to our benefit, that it's actually a well-known and well-understood technology. We're not just bringing something new to the field and saying, oh, trust us because it's new. No, I actually can point to hundreds of doctors around the country who have used electroanalgesic therapy for years or even decades. I know a few who've used it over 20 years in their office, which is great because it has that established presence in the medical field. So it's not brand new. What we're doing is actually understood and it works. And there's a reason why doctors don't do it and why they just kind of avoid it. And I'll explain that here in a second. So going back to electroanalgesic therapy, now IV hydration. Most chronic pain patients are chronically dehydrated, chronically nutritionally deficient with some sort of vitamin or mineral that they are missing or lacking. The IV hydration is a great supportive therapy to this program. We noticed over the years that patients who will engage in the IV therapy along with it simultaneously, they have faster onset of outcomes, they have stronger outcomes, they get out of pain, have a lower pain score, and then typically it'll last longer. Now, these are all subjective observations, right? We're just like, we're observing patients and we just are pooling the ones together in this group and this group, we're just keeping track of it. But, that's just our observation over thousands of patients, is that, the ones who are doing the IV combined typically do have better outcomes than the ones that don't. So then that being said, the IV is just a simple vitamin mineral mix. IV, it's not complicated. There's no medications involved. And that's what the IV is. By the way, neurofunctional pain management is non-pharmaceutical, non-surgical, non-invasive, and non-chiropractic. And I just want to throw that out there so everybody will understand that we're not engaging in one of those categories. So the IV feels great. Everyone loves it. Helps with the pain issues as well. So it contributes to the effect of the pain relief. And I could actually probably speak for hours on the specific. There's specific physiologic benefits occurring with the electrical therapy and the IV combined. Don't want to get into that right now. We're just talking about the basic, neuropathy mobile program for Florida here. But that being said, wanted to just mention there's a lot more there going on, which is great. Health coaching. Patients, the first thought is, okay, that's not actual, therapy, right? It's not going to actually help me. But here's what happens. Patients with chronic pain issues oftentimes just don't have a lot of, I don't want to say anything negative, like there's not a lot of hope. I mean, I'm sure a lot of you do have hope if you have chronic pain, but there's a lot of people out there where if they're in chronic pain, there's not a lot of incentive, I should say, to try and actually keep the diet good, keep other things good. I mean, you're in chronic pain, then, why do I have to worry about, what exactly I'm eating or whatever else, because I'm already in pain, right? So, but here's what happens when you actually start getting out of pain, suddenly there's a light at the end of the pain tunnel. And you're like, oh my gosh, I see that I can actually get out of pain. And I would like to overhaul my everything. I want to clean up my diet. I want to start walking. I want to start getting exercise. I want to start being healthier. Right. We've noticed hundreds of patients that took the opportunity to just level up their whole health profile after getting out of pain. So the pain was literally holding them back on everything. So we get them out of pain and everything improves. And we've seen so many patients have these amazing total physiologic overhauls after getting out of pain. All sorts of positive benefits have occurred for patients. I don't want to go into all of those details because it makes people think that they're going to have all of the different things. Not everyone gets all of the same outcomes, but I've seen consistently a very high number of people have improved and better sleep. That's just is almost every patient seems to come back and say, I slept great for the first time in years last night after doing their treatment. Right. So they sleep better. We've had hundreds of patients that have improved other benefits. Some of the, just off the top of my head, blood pressure and cardiovascular functions seem to improve for a variety of people. We have to go back and look at why in specific situations some people had better outcomes and others may not have on that specific category. So we're not trying to promote it's going to help that area, but some people do improve. A lot of doctors say, well, if they're out of pain, the stress level is likely significantly reduced. Now that would actually significantly improve their cardiovascular function, right? And it makes a lot of sense. Out of pain, stress reduces, blood pressure might go down, everything's feeling better, right? Because the pain's going away. So there's a lot of possible reasons why the cardiovascular improvements occur. Sleep, obviously, is, the pain's gone, so people can actually sleep through the night. That's one of it. But there's a few other very specific physiologic reasons why people sleep better that are involved in the actual therapy as well. And then another one is breathing. We notice, and a lot of people tend to have better and improved breathing. As I'm saying this, everyone's taking a deep breath. But for some reason, a lot of people started to have that. And that could be related to the cardiovascular improvements, and it also could be related to just being out of pain. But in general, we're out here to treat, pain issues. And that's what we're doing, is treating pain. And the result is a lot of additional benefits that we just observe that happen. And patients are coming back and telling us all these great things are happening. So all of those things are happening. The health coaching is an opportunity for one of our mobile nurses to talk to you while you're in the treatment program and just help you improve your health one little bit at a time. They're going to go over a little bit of something every single time they visit you and do a little health coaching visit with you while they're there. Okay, so outcomes and successes. Across the board, 85% success rate. That's from talking to all the doctors that we've worked with, getting their subjective opinion on what the percent is. So that is just the doctors telling us. And we've talked to a lot of doctors about this and asked them what they think the success rate is. If they had to give it an average across the board, they're telling us 85% of patients are achieving a greater than 50% reduction in pain. That's how they classify that. So imagine, somebody coming in with a pain on the scale of an 8, and then 85% of people are completing the program with a somewhere 4 or lower, right? Greater than 50% of reduction, which is a huge success in the world of pain management. I know some doctors who were aiming to get a 10 or 20% reduction with patients by switching to a new med or doing a little thing here or whatever. And in a lot of cases, the interventional procedures and surgeries, some of those, some scenarios make it so you can't even get those. You're not even eligible for those interventions or those surgeries. And then a lot of people have also experienced those things do not necessarily actually get you out of pain. Some of them help, some of them work, some of them are very short-lived, and then some of them actually make things worse. There's lots of patients that have that can end up with worse pain after going through different surgeries to try and reduce pain. So it's all over the board when it comes to all the invasive stuff, and that's why we see a lot of patients coming to us because they haven't had a chance to try this, and this actually works. So if I were going to tell patients about all this, and I'm saying, hey, you got medications, you got surgeries, you got invasive procedures, or you have neurofunctional pain management, which one would you want? Say ours is safe, it's effective, it works, and by the way, it is covered by Medicare and commercial insurances. Our coding and system and our billing system for this is using standard billing profiles for everything. We're not some crazy thing out there. New, like I said, it's not new. It's just been in the system for decades, and it's been used in doctors' offices and been reimbursed for decades, right? So, again, I'll tell you why doctors don't do it here in a second, or why they haven't really latched onto it over the years. But again, going back to that 85% success rate, some of other conditions, actually, the doctors would say, yeah, I actually have better than that average. I have better outcomes with certain things, neuropathy, fibromyalgia, a couple of other different conditions. They have noticed that they have even better than 85% averages with those specific conditions. All right, so there are some things where, I mean, 90, 95% potentially of patients that go through the program are going to end up with a greater than 50% reduction in pain. So that's amazing. And okay, so why don't doctors do this? Sorry, hold on. One more thing. 85% reduction in pain. How long does it last? That's another question a lot of people ask. Well, if I do this, how long will it last? Our average and our expectation for patients is to somewhere between 3 to 6 months. That's what we've seen countless times. I'll say countless, thousands, maybe thousands or hundreds and hundreds of times. We've treated thousands, maybe even tens of thousands of patients around the country with this program. And I would say, yeah, I couldn't put an exact number on it, but the expectation that what we're aiming for is 3 to 6 months of duration. So they complete the program, 3 to 6 months of duration. And I've seen plenty of patients that have lasted longer than that. I've actually talked to patients who have had over a year of pain relief. They finished the program and then they lasted an entire year before the pain started coming back. What will typically happen is that you'll get out of pain, and then there will be a period of time where it will stay fairly resolved. Pretty much, wherever you landed at the end of your program, it will last for, so many months, X number of months. It'll start coming back, and the pain will start gradually coming back. It doesn't just all come back on day one. 6 months later, 6 months and one day, I'm back in pain. It doesn't work quite like that. You'll start feeling it come back again, and then most of the time, those patients will reach out to the office or to one of the nurses and say, "Hey, starting to have pain again. I'd like to get back into the program." Absolutely, and we can get you back in. So, okay, why don't doctors do it? Well, if it works so well, why haven't I heard of it? That's what I've actually talked to probably dozens of doctors who would ask me that same question. Well, if it works so well, then, and I am a doctor in this field, they would say, then why haven't I heard of this thing you're doing that's supposed to be so great? And I'm like, well, it's so funny because I've met plenty of pain doctors who were trained and actually, did their well, I guess we'll say their mentors, their trainers, and the people that they worked with for years to become a pain doctor actually probably did use electroanalytic therapy in their offices, and they just quit using it years ago, and then they just didn't teach anybody else about it, or most of these doctors just haven't done it. And here is why. That I mentioned, the program requires some ongoing treatment for it to occur. A single treatment will produce a few days of relief. And that's typically what most doctors had done with it in the past. If a patient came in and they couldn't do medications and they couldn't do surgeries or interventional things, they would say, well, we could put you on this. And they would let the patients just kind of pick it. They'll let the patient self-direct when they would come in. Well, I'll come in and do one of those little electric treatments you have, and then the doctor says, sure, come on in. Well, the issue with it is that it takes time. I mean, these treatments, this is an hour-long treatment, and the doctor's offices do not have time to deal with that. I mean, how many offices do you know will let you come in there and sit for an hour in one of their, rooms and take up space for an hour? They just don't do that, right? So that's actually probably reason number one, because of the doctors that do know about it, that's actually the reason why the ones I know who actually like the treatment model, they don't do it because they just don't have room. They don't have time, they don't have room, they don't have staff or equipment. All of those things make this very difficult, because if you're going to do this in your office, you would need multiple chairs. You need multiple sets of equipment. You need staff to manage it. And then those patients need to be in there for an hour, right? So it's kind of, a limiting, it's a rate limiting issue for doctors, just the time that it takes to do the treatment. So that's the problem. That's actually the number one problem why doctors don't do it, which is also probably the number one reason why doctors don't tell and instruct new doctors on how to do it, is because they're looking for ways to handle the numbers of patients. And I'll say that again, I'm not talking about pain doctors at all here, because I know hundreds and hundreds of them. A lot of them are good friends of mine, and there's nothing negative I'm explaining here. This is just the industry itself. These pain doctors are dealing with hundreds and hundreds and hundreds of patients with a wide range of pain conditions, not just neuropathy. We're talking about that right now, but they have all sorts of issues, and every single patient's got different things they're dealing with. So the doctor is trying to find the fastest and easiest way to get some treatment to these patients to manage their pain. That's what they're doing. The interventional model, where they do the spinal injections and the steroid injections and epidurals and ablations, all those things have been developed over the years as ways to try and do single procedures that can have long durations. And that's what they're working on, right? And again, a lot of those procedures work great for people. And I've met people who've gotten them done, all sorts of those different, interventional procedures. They work great. But there's a lot of people where it doesn't really help. And sometimes you can only get a couple of them a year. And then oftentimes they do start wearing off again. If you do one of those injections twice a year, 2 or 3 years later, that injection is only effective for a fraction of the time it was the first time. So maybe it lasted for 3 months the first time, and maybe it's only a few weeks after a couple of years of doing that, a few weeks of success with it, and now your body just is not responding to those things anymore. So that's what I've seen with, again, countless patients coming through the office that I've run the course of my interventional injections, and I don't have anything else I can do. Medication's worn off, no more injections available. I'm not eligible for surgery, right? So what do you actually do if you're a patient in that situation? So that's why neurofunctional pain management is so valuable to the medical community and to the pain community, is because in this mobile program, in this mobile model, we can actually have a mobile nurse go out to your home and treat you there. So one, you're not having to go into an office. You're not having to deal with the travel pain issues. You're also not having to take up, and I say that politely, not taking up a room in the doctor's office for a whole hour, a room that needs that, 10 other people, 5, 6, 8, or 10 other people are going to need to use that room during that hour at some point. So having the nurse go to you in your home is actually a huge turn in the industry for doing this. So now we can actually treat you in your home for an hour event. The nurse will come out there and do that. So this really does make this whole treatment model now accessible, much more accessible to everyone who needs it. So again, we are talking about treating peripheral neuropathy pain in your own home using the RELATYV mobile pain treatment program. And we're using the neurofunctional pain management treatment modality. And I encourage all of you who have questions about this to reach out to us. I have a link in the description of the video here. Go straight to our website, take a look at the site, read about it, and also too, you can fill out the insurance form to see what your coverage options are, because it is covered by Medicare and commercial insurances. We just have to do a quick check to see what your specific plan has lined up for treatment for coverage. But that's pretty quick and easy to do. Our team will reach out to you and get you moving forward, get you started. And we've hopefully have nurses right around your area. For everyone who's watching this in Florida, that's a big state with a lot of people. And we're always bringing on more nurses. So as we start seeing this happen and grow, we'll have hundreds and hundreds of nurses all over the country doing this, which will be exciting. So I hope that we can get you treated, and I hope that you reach out to us. I look forward to seeing you in our system. Thanks so much.